the virus during this current outbreak we've been following.
And of course, there is no cure, there is no treatment, there is no vaccine. So medical personnel treating patients with Ebola have to protect themselves.
Right. They have to do whatever they can. Hospitals such as Intermountain Medical Center are equipped to handle such a disease, and we're learning a little bit more about that this morning with news specialist Ann Forrester live this morning at Intermountain Medical Center. Hi, Ann.
Hi guys, so we're here just outside the decontamination room. So if a patient who was infected with Ebola or another serious infectious disease, this is how they would come through. Now, there are a series of steps that have to be taken when a patient comes through here. Now, this room is divided into 3 areas. We have John Little, who's the assistant manager with the emergency department. And John, walk us through what a patient would do if they were to come through this room.
They were warned ahead of time, and the patient would come through this area. We have what we call the hot area. They'd be disrobed, and then they would be moved along to the second area, which is the warm area, where you can see all the shower heads. They're completely washed down, taken care of, and then they will be moved to the third area, which is the cold area, where they'll be given proper patient gowns and be prepared to go into the main part of the emergency department. They'll be assigned a room and ready to go.
So once they are past this point, they're dressed, they've been cleaned, where do they go from here?
Then they will go to a isolation room. It's actually negative pressure room. This room is set up so that when all the air that comes into that room sucks into the room, it doesn't go out into the general emergency department, which is a perfect way to keep airborne pathogens in one place. And that's all separated from the regular department.
John, thank you. So we've just walked through the 3 areas of this decontamination room. Now, coming up at the top of the hour, we're going to show you a suit that doctors and medical staff use to stay safe in the midst of an infectious disease. Back to you guys.
Boy, fascinating to see this, Ann. Thanks for the update this morning as we take a look at how Utah would prepare if something, say, the Ebola virus were to come here. Ann, thanks.